Right, a very, of course, good morning again and welcome back to your world. This morning we want to shift gears a bit and talk about the National School-Based Deworming Program, which is essentially a partnership between the Ministries of Education and that of Health to be able to address the challenge of intestinal worms, which is a risk facing at least 6 million children in Kenya. We have representatives from both the Ministry of Health, the Ministry of Education, and the county of Kisumu to help us understand what exactly is this program all about, what it means for the country, and why this needs to happen right now. And joining me in studio this morning is Dr. Christine Wambugu. She's the head of the Division of Adolescent and School Health at the Ministry of Health. Good morning, Dr. and welcome to the show.
Good morning. Thank you. All
right. Joining us, of course, this morning virtually from Mombasa is Madam Nerea Olik. She is the Director of Primary Education at the Ministry of Education. Good morning and welcome to the show.
Thank you so much. Thank you.
All right. And also joining us from Kisumu this morning is Jeremiah Ongwara. He is the County Public Health Officer in Kisumu County. Good morning, Jeremiah. It's good to see you. Welcome to the show. Jeremiah, I think he's trying to set it up, but maybe this gives an opportunity to us to begin this conversation with you, Dr. And when I hear the National School-Based Deworming Program, the first thought that comes to my mind is Minyo. Is it correct to say that? And what maybe you can use this opportunity to talk to us about what exactly the program is all about, and why are we talking about it now? Is it something new? Has it been ongoing? And the progress so far?
Yes, so the National School-Based Deworming Program actually began in 2009. So it has been ongoing for quite some time.
Okay.
It is actually one of the projects that we have in collaboration with the Ministry of Education, the Ministry of Health and Ministry of Education. We have a joint school-based school health program that looks at different areas to make every school a health promoting school. So we are looking at things, like values and life skills, water, sanitation and hygiene in schools, nutrition in schools, control of communicable and prevention of non-communicable diseases, and so on and so forth. So the school-based deworming program is actually nested within this larger school health program. And as I mentioned earlier, we implement it in collaboration with the Ministry of Education and the Ministry of Health, and we treat school-age children, that's 2 to 14 years, for soil-transmitted helminths. So these are basically three main diseases: the roundworms, the Ascaris lumbricoides. We have the whipworm, the Trichuris trichuria, and then we have the hookworm. That's the Necata americana and Acyclostoma duodenalis.
Okay.
So those are the worms that we are actually treating. We use the drug albendazole, 400 milligrams. That's given as a single tablet, as a single dose.
Okay.
And this is eliminates now the worms from the learners.
You mentioned that this began in 2009. Yes. What used to happen before 2009? You used to seek private treatment?
Yes.
Okay.
So it was mostly symptomatic treatment, where if a child had signs and symptoms of worm infestation, they would present at the health facility. So the World Health Organization actually recommends in areas where the prevalence of worms, these soil-transmitted helminths, is above 20%, they recommend that we give what we call mass drug administration, where we give medicines to everyone who is at risk. So, and here the learners 2 to 14 years are most at risk, so we give all of them. Yes.
Okay. So let me just bring in Jeremiah at this point. Jeremiah, so do we have areas then that are a bit more prevalent, like the way we would say COVID-19 or mosquitoes are more prevalent in this area? Do we have areas where the issues of intestinal worms are a bit more prevalent?
Thank you very much. My name is Jeremiah Ongwara, County Public Health Officer, Kisumu. There's a lot of echo.
Yes, proceed as we try to sort that.
Yes. So my name is Jeremiah Ongwara, County Public Health Officer, Kisumu, in the County Department of Health and Sanitation, County Government of Kisumu, the great county of Kisumu. We are discussing National School-Based Deworming Program. And just like my colleague, Dr. Christine Wambugu, has stated, This is a program that is supported by Evidence Action, the Warm the World Initiative, in collaboration with Ministry of Education, Ministry of Health, and together with our county governments. And the program has been or is in 27 counties. And this year we are in 21 counties that will be able to deworm starting from today up to 16th. And we shall deworm for soil-transmitted helminthes. These are common worms such as whipworm, Trichuris trichiura, roundworm, Ascaris lumbricoides, and we have hookworm, which is Ancylostoma duodenale or Necata americanus, and also the schistosomes, and schistosomes are of different species. We have Schistosoma mansoni for the intestinal infection, and we have Schistosoma hematobium for the urinary infection, and the rest like Schistosoma japonicum, which is very rare in the country. And hello?
Yes, proceed,
and hello?
Proceed, Jeremiah, please.
Yes, and we have been doing it, and we are using a cascade approach. We are targeting children 2 to 14 years, both enrolled and unenrolled. And when we talk about enrolled children, we mean the children who are in school register, and the non-enrolled ones are the ones who are at home. Probably they are not in ECD.
Yeah.
These are 2 to 3 years, and all of them are eligible for deworming. And this year, we are deworming in Nyanza region, Western region, Rift Valley, and Coast. And we are using albendazole tablets, 4 milligrams. That is one dose for the children 2 to 14 years. And this drug is very safe, free, effective, and recommended by World Health Organization for deworming of children, so that we can improve their health and education. And we have seen the effects of worms in children, that worms can interfere with the nutrient intake, and which can lead to anemia, malnourishment, and this can also impair mental and physical development in our children. And we have seen studies done, and a study done by Kenya Medical Research Institute in the year 2012 and 2018 indicates a huge drop, a 62 reduction in the prevalence of worms in the sampled population, that is the sampled children who are dewormed. A huge reduction, 62% reduction in the prevalence of soil-transmitted helminthes in the children who are sampled. So that is a very huge reduction that we have seen.
Okay.
And we have also seen other benefits, like we engage teachers, and the benefits that the teachers would want to see are increased concentration, increased participation, and reduction in school absenteeism. That's also another benefit. And so we use cascade approach, and the cascade approach is that we have the county planning meeting first, where we have stakeholders who are brought on board. Then we have the sub-county trainings where we involve the ward and divisional level teams, Ministry of Health, Ministry of Education, they are brought together. We train different players. Then after the sub-county level trainings, we go to the teacher training sessions, which is done all over. All the deworming counties have to do it in preparation for the deworming day. And today in Kisumu, as we talk, the deworming day for Kisumu is today, 15th September 2021. And we are targeting children 2 to 14 years with albendazole, which is a very safe, free drug, same drug that we have in our facilities, government facilities, that we are using, recommended by WHO, World Health Organization.
Yeah.
And we are going to deworm in Kisumu over close to 400,000 children, both enrolled and unenrolled. And all these are eligible. And we're just calling upon parents to be able to support this program, to be able to encourage children to be able to be dewormed in our school, public, private primary schools, including ECDs.
Okay. All right, and now that, I mean, Jeremiah has been very comprehensive in terms of the impact of what this would mean for the children, especially from the health perspective, if left untreated. Let's just get to hear from Nerea. Madam Nerea, what would happen if we were to, these children were not to be treated in terms of how it would affect their education?
Yes, thank you so much. I want to say that any nation that look forward to its future must really take care of its generations that is looked at to be the human resource of the future. And that is why we partnered with the Ministry of Health together with Evident Action to ensure that we have a healthy generation of human resource to come in future. As we hand over, we must hand over to a generation that really grew up in a well taken care of environment. And that is why we are now deworming. As you've been told by my colleague, Dr. Christine, we partner in several areas. Deworming is just one of the components that we cooperate and work together and partner with the Ministry of Health. We have seen a lot of benefits coming out of our partnership, especially for the deworming program. One of the areas that have even been talked about by our colleague from Kisumu is the reduction of absenteeism. When a learner is not dewormed, we find that a child may suffer from infectious diseases, which can cause the child to stay out of school. And this normally affects their learning. But with the deworming in progress, we have seen increased teacher contact hour, which to us that is very key, because a learner is supposed to interact and engage with the teacher at a very optimum level. And we have seen that. And then the other aspect is the concentration level. A child who has been dewormed, the concentration level of that child in the classroom is very high. And we have seen it impacting even in the results that comes out of the same. In the recent past, since the deworming started, we have seen increased level of exams results coming out. And these learners have been performing quite well. We also look at the cognitive and physical growth of these children, which you have seen that is very much at the level or in which they are supposed to be. And therefore, we do encourage that this deworming should be appreciated, and our parents should embrace it and ensure that we take our children, our learners for deworming. We do not only look at public schools. The deworming takes place in both public and private schools. And ECDs, as well as those learners or children who have not come to school, who are at home, we do encourage the parents to bring them along on this particular day, and especially in this period when we are carrying out deworming between today, 14th to 16th. You've been told that we are doing it in 21 counties. In March, we did the first phase of our deworming for this year. Being that the learners had stayed out, we all know what affected us globally, the COVID-19, and that exposed our learners to various infections because they were out and in various different types of environment, which may have caused them to be infected or get worms. And therefore, we moved very fast to ensure that we wormed 2.6 million learners in Western Kenya and in part of Rift Valley. Currently, as we've been told, we are in Nyanza, we are in Western, we are in Coast to do the same for the period of 3 days. And we hope that we will get a lot of support from our learners. You've also been told that the people who are administering are our teachers who are trained. Our teachers,
please proceed, Lorraine. Yes,
who are trained to administer the drugs. Why did we choose on the teachers? Because the teachers are the familiar figure in at that formative stage of the learner. The learners appreciate, understand, and take care of each and every word that they've been given by their teacher at that formative stage. So we want to say that together with the county governments, we come together because we know that the Ministry of Health, part of it is devolved, and therefore we must work together as intergovernmental, interministerial to ensure that we build a healthy nation. Thank you so much.
Let me come back to you, Dr. Wambugu, on the issue of the program, because then clearly, I mean, what I can see, seeing the Ministry of Education, the Ministry of Health, the county governments driving this, clearly shows the commitment of government towards this program. But maybe let me just take you back some 12 years back. What was the idea behind government now coming back and saying, you know what, we're going to take over and start rolling out this program to our learners across the country?
Well, maybe I can take a step slightly back from that.
Yeah.
In 2021, the World Health Organization recognized that soil-transmitted helminths, these worms, were actually an issue that were impairing the cognitive development, the physical development of learners in school. And they made a resolution that countries adopted, Kenya being one of them, that we were going to look at ways of eliminating these worms as a public health problem. Yeah. So Kenya, in 2009, we came up with the school health policy jointly between the Ministry of Health and the Ministry of Education, and the school deworming program was part of that policy. This policy has since been revised in 2018, and now we are looking at a new strategy where we are looking at making every school a health promoting school. So that has been just a summary of the development over time and how the cooperation between the Ministry of Health, Ministry of Education and the county governments have come together. So there are several activities that go hand in hand. So the deworming exercise is not an exercise in isolation. You know, these eggs are passed out from the infected person into the soil, and so we are looking at issues of water sanitation and hygiene. You have to have clean, safe water, because if you have contaminated water, it leads to infection of the learner. If you have contaminated foods and vegetables, fruits and vegetables, the learner can also get infected with these worms. So we are looking at also safe food. Some of these worms, like the hookworm, the larvae can penetrate the skin. So we're also talking about, you know, shoe wearing for the learners and all, to prevent that, to break that cycle of transmission. So the deworming exercise, giving the drug, is one aspect of the entire program of controlling the soil transmitted helminths, but it goes hand in hand with all these other interventions that we are doing together under the school health program.
Okay, but I think Jeremiah mentioned that it's 27 counties. One would wonder why not 47?
So initially, when the program began in 2009, KEMRI, being the government agency that is responsible for research, took some samples across the country, and we were looking at, remember I said that WHO is recommending where the prevalence is greater than 20%, we are going to give, they're recommending that we give drugs to all the children at risk. So KEMRI identified these 27 counties that had that met that threshold of over 20%. And WHO recommends if it's between 20 and 50%, we deworm once a year. But if the prevalence is above 50%, then we deworm twice a year. So these 27 counties were identified that had reached that threshold. For the other counties, what we recommend is that a case-based approach, where if a learner or a child has symptoms of worm infestation, they present at the nearest health facility and they can be treated on a one-on-one basis. Okay. Yes.
But then again, I know we spoke about the benefits earlier, but we didn't touch on the economic benefits of this.
Yes, so there have been some studies that have been done on the economic benefits of deworming. So we have Professor Michael Kramer. He's actually a Nobel laureate who did a lot of work on health economics, and he did a study in Kenya where initially when the program started, the children who were dewormed were followed up for 20 years. Now, they found that these people who had been dewormed as children compared to those who were not dewormed had about 13% better earnings. They passed their class, their grades, their class 8 grades, by about 9.5% points. And in essence, the earnings that they got when the computation was done, for every dollar that is spent treating one child for worms, you accrue a $230 benefit to the individual.
Oh.
And for every dollar that is spent, then from that income that the individual gets, the government actually gets about $16 on top. So you can see the benefit
to individuals and to government.
And to government,
okay.
yes.
Amazing.
And following that, you can see the whole of government commitment. So the Ministry of Health, the Ministry of Education, the county governments putting resources together because of you can actually see this is of economic benefit. Yes.
All right, but even before we close this whole issue of the benefits, then for any parent who is watching right now, they're a bit reluctant, maybe their children don't even go to school, what do you have to say to them?
What I can say is that the drug that we are giving for deworming, it's very safe. It has almost no side effects. It's effective to treat the worms, and you can see the benefit to the child. The child who has worms is actually quite lethargic, looks tired all the time. They don't get optimal nutrition. They don't develop physically as well. With severe infestation, you might actually find the child is stunted. That is short for their age, and you will find like maybe they are not able to concentrate in class. Their cognitive functions are not that good as compared to those who don't have worms. So once the child is dewormed, you can actually see a marked difference, a marked improvement in the demeanor of the child, in the health of the child, and so on and so forth.
Okay, yeah. It reminds me when we were in primary school, there used to be some of us who were really skinny and we used to be told, ni minyo inakufanya. But really, that's where we have to leave it. We have to go for a quick commercial break, but when we come back, we continue about this. But, well, even before we go for that break, then let me just cross over to Jeremiah, who is in the county health officer in Kisumu County. Jeremiah, this treatment program, very impressive by the national government, but one would argue that it is just treatment. Why can't we talk about prevention? What are these factors that affect or cause children to be affected or end up with intestinal worms?
Yes, thank you very much, Kiprop. The reason why we target children is that they have the highest infection burden, and the reasons why they have the highest infection burden for the intestinal worms are children are often barefoot, and you have seen that in many schools, school children, primary school children they go to school barefoot. In fact, probably maybe by Form 1 is when some can get shoes to wear. And when you walk barefoot, you are really at risk of getting infected with hookworm, the eggs of hookworm penetrating your feet, penetrating your skin. Yes. Then the other factor is that children practice less hand washing. This is a behavioral practice that we are seeing, and we can educate them to be able to enhance. And hand washing is the first line of defense and can prevent many diseases. We know hand washing at critical times. And when you after visiting a toilet, you need to wash your hand. Before you eat, you need to wash your hand. Before cooking, you need to wash your hand. And after changing a baby's nappy and any other critical time. So that's just another area that probably is not well observed by children. And the other factor is that children often they don't use latrines. And we are talking of soil-transmitted helminthes, soil-transmitted infections, the worms. An infected person will defecate in the open, and then another person comes, either eats a raw vegetable, or eats probably a raw vegetable or a fruit or soil. And then you can ingest it, you can swallow it through your mouth, or roundworms can penetrate your skin or can be ingested, or hookworm can penetrate your feet if you are barefoot and get into you, or schistosomes. We have talked about schistosomes, bilharzia, kichocho. If you swim, children like swimming. If you swim or play in water, and that's a behavioral thing in children, they are likely to be infected with the eggs of bilharzia schistosoma. Schistosoma mansoni will get into your intestinal system, while the schistosoma hematobium will get into your bladder system, urinary system. So the eggs of bilharzia will penetrate, and this is just actually, the vector there is a snail, yes? The snail, Bulina snail species, which will be able to give you this infection. And at the same time, we have seen children their lifestyle and all this. So when we talk about intestinal worms, we are looking at the predisposing factors are poor environmental hygiene and sanitation, which we need to address. We need to ensure that we wash our hands, we must wash our vegetables, we must wash our fruits, and we must wash our hands at critical times. And the most critical one, we have to stop open defecation. We must stop open defecation by providing latrines and using and training and educating people on how to use latrines. Just like where we are in Nyanza region, we have a very, very robust wash program, water and sanitation program. Kisumu, we have community-led to sanitation, school-led to sanitation, urban-led to sanitation, which are geared towards improving hygiene and sanitation so that we can reduce these intestinal worms, we can reduce waterborne infections, we can reduce all hygiene-related diseases, including even COVID-19, that we have to really ensure that we wash our hands with soap and clean running water, and we must keep social distance, we must wear our masks, and we must sanitize. Okay. So you can see this is a hygiene-related condition that we have to talk about and address.
Okay, and I like that because it's a more sustainable approach. Let me just bring in Madame Nerea. Given the requirements that as outlined the issue of sanitation facilities, do we have this and adequately so in our schools?
Yes, thank you so much. To respond to that question, we are all aware that when one of the conditions for reopening of schools was to ensure that we have adequate wash facilities in our institutions, both primary, secondary, and even tertiary. In our primary schools currently, where we are carrying out the deworming, each and every institution has wash facilities, where one of the regulations is to ensure that as you arrive in schools, you wash, you clean your hands. The schools are providing water and soap, and therefore it is quite crucial that each and every learner has to wash their hands. However, we know that the young ones, aged 2 to 12, they are really playful, they are also very much forgetful, and that is why a lot of times you find that the water hand washing points are available, but a lot of times they forget to wash their hands. Coming from the washrooms, they are also supposed to wash their hands, because the wash hand washing points have been placed all over in our institutions, and we expect them to do the same. We appreciate the work that has been done by our very, very able teachers who have been very keen to ensure that there is always water available, there is always soap available, and they train a teacher who is called the health teacher in the school, who provide all the directions and information as per the health issues, is always very keen. And you find that teacher arriving in school quite early in the morning to ensure that as the learners arrive, their hands are cleaned. So that is where we are. But we want to appreciate the work that has been done by our government. Indeed, the provision of this water, the provision of the soap that is being used have been done by our government in partnership with other organizations, as well as our local leaders who are in charge of the various constituencies, counties. The county governments have come up, the MPs have come up to assist the government to ensure that we get to this. So far we have over 23,000 primary schools, public primary schools. We have over 2,000 private schools, and we also have quite a number of ECDs, because our schools are always attached to ECDs. We have standalone ECDs, which also must be taken care of. We also have those learners that are at home. We have what is called sometimes the baby care, or the learners who have not really reached the age of going to school, but they also have to be taken care of, because a lot of times perhaps their parents may not be aware, or if they are aware, they may not have the time to carry them to the institutions to go and be dewormed. Okay. So far the government has done a lot, and as a Ministry of Education, we take a lot of cognizance. As I'm talking from Mombasa right now, my class, the Chief Administrative Secretary for Education, Dr. Sarah Ruto, is representing our Cabinet Secretary in the same function in Kisumu. So you can see how much serious, as a Ministry of Education, in partnership with the Ministry of Health and technical assistance also from Evident Action, we have taken the issue of deworming and the health of our learners, especially those young ones, because that is where the future of the country is. Thank you.
Thank you, Nere. But let me just come back to you, Dr. Ombogo, then. So, but even as a parent, because this is a shared responsibility, at least from where I sit, what are those things I should look out for from my child, that if I see certain thing, I know maybe the child could be suffering from this worms?
So the common signs and symptoms of a learner who's infested with worms, as I mentioned earlier, is tiredness, lethargy. They don't want to go out to play. They have loss of appetite. They would occasionally complain of stomach aches, headaches. And if the child is infested with hookworms, it also gives anemia, where you have reduced blood levels. So you'll find the child will be looking pale and generally tired. So if a parent notices that the child has any of these symptoms, they should present to the nearest facility to be evaluated and given the appropriate medication or the appropriate intervention.
All right, but do we have this, because I think the program targets 2 to 14 years. Do we see these effects extending even at adulthood?
Yes, so for the adult, as my colleague in Kisumu, Jeremiah, said, is that these 2 to 14 are the most affected. But for the older child, we have fewer cases than in this other age group. So for that age group, we recommend that it's symptom-based. Like if you have symptoms, you present to the facility and then you can get dewormed. So this, the Mass Drug Administration, like the drugs that we are giving now to everybody, every learner in a class or every learner in a school, is actually recommended for that particular age group. But above that, they can still be able to get the deworming medication at their nearest health facility.
Last thing before I cross over to Jeremiah, issue of cost. We like to ask these questions because we don't want to go, the information is it's free, and then you get there, you're told,
no, it is completely free. The medication has actually been bought by the government of Kenya. So this even shows the commitment that the government has towards this exercise. It shows the sustainability, because now we are making the program more sustainable. So the government has actually purchased these commodities, and the cost is free to every learner.
Okay, all right. Let me cross over to Jeremiah then and ask, maybe since 2009, this project has been ongoing in terms of the benefits and the gains. And I know she has mentioned in terms of course, the potential economic benefits for a government and for an individual. But for the last 10 years that this program has been ongoing, at least from where you sit, do you see positive progress in terms of what this means for the country and our children?
Thank you very much, Kiprop. From the year 2009, yes, we have seen a positive impact in the deworming program. We have seen studies. We have just discussed studies here, and we have seen studies done by Kenya Medical Research Institute, indicating that there is a 25% reduction in school absenteeism. That is really a positive response towards the common ones. We have also seen the studies done by Michael Premier, telling us that the income levels for the children who have been dewormed 2 to 3 years increasing, and almost more than 13% more than the children who are not dewormed, the new sample children who have been dewormed. We have also seen now teachers really much more motivated in this program, because we train teachers. If they are well trained, then they are able to administer the deworming drugs. So teachers are much more involved, the education people are much more in it, Ministry of Health are much more in it.
Yep.
So this is a program that we are seeing also, and the issues of cognitive and physical development, because the main benefit that teachers would want to see is increased concentration, participation and reduction in absenteeism, which we are seeing 25% reduction is being revealed by studies by the government of Kenya. And also the issues of hygiene is really being enhanced, because as we talk about national school-based deworming program, we are also doing integration of hygiene, school health program, and we have seen also a comprehensive school health program. And the other time we launched the school health program, the document, which are being disseminated. And also the public are accepting it. We have seen stakeholders coming in to support this national school-based deworming program. So we are seeing a positive response towards this, and we are targeting common worms. We are also targeting the schistosomiasis bilharzia, because we are looking at what we have just said here, that the worms will interfere with nutrient intake and can lead to anemia. Anemia normally leads to low concentration in class, which can lead to poor performance. And you saw the other study by Michael saying that 9.5% of the children, girls, actually, now look at the girl child, were able to perform well and get their entry grade into the next class of 9.5%. That's really another benefit we are seeing here. So we are seeing a lot of benefits from the studies, and the program is planning to do impact evaluation, the evidence action, in collaboration with the county governments and Ministry of Education and Ministry of Health. There's a plan to be able to do impact evaluation of this particular program, the National School-Based Deworming program in our counties, in the 27 counties, and this year we are implementing it in 21 counties. Yeah. And so far, as we talk, from today 14th up to 16th, we are going to do the deworming in 14 counties. That is Narok, Nyamira, Kisii, Migori, Busia, Siaya, Kisumu, where I am, Kisumu County, Homa Bay, Lamu, Tana River, Kilifi, Mombasa, Kwale, Taita Taveta counties will be participating from 14th today up to 16th. And today, you have just heard that the CAS is visiting Kisumu, and we are here in Manyata. That is the site that will be visited. But the deworming exercise is taking place in all our public schools in Kisumu County.
Okay. Let me come back to you, Dr. Mbogo. So if, in case I'm not in this 27 counties, and I'm seeing the symptoms that you mentioned earlier, the child behaving in a funny way, and I'm not in that, the list of counties which benefit from this free program from government, what do you think I should do?
I think you should take the child to the nearest health facility, and if indeed they are found, there's a test that will be done where they'll take a sample, take it to the lab, and then they'll be looking for the eggs from the sample. And if the eggs are identified and the child has been seen to be having these worms, they'll be given the albendazole. It's actually a very cost-effective drug. It costs less, I think, than it's a very cheap drug. It's less than 50 shillings actually for that one tablet. Okay. So the treatment is actually quite affordable.
Okay. Yeah. Let me cross over to Nerea then. Madam Nerea, you mentioned earlier the impact that COVID-19 had, because I think the children were home for about 6 or 7 months or so. Have we been able to perhaps make up for the time that was lost and the children who were not treated during that period?
Yes, thank you so much. On the issue of the timetable, I think you've seen how rigorous our timetable has been, and you've even seen how parents have been complaining that we've not given them adequate time even to prepare and even to stay with their learners at home. It's because we really want to catch up with the time that we lost during the time when our institutions were not operational. Okay. And that is why immediately, together with the Ministry of Health, we moved very fast to ensure that we deworm the 2.6 in the western and part of North Rift Valley. Currently, as we target to carry out our deworming, starting today, our target is 4 million learners.
4 million learners?
Yes. Okay. So our target for this year is 6 million and above. Okay.
All right. Thank you. Let me come back then to you, because part of the reason we were asking about the issues of the areas that these issues are much more prevalent is because we're trying to look at this in a more sustainable way. Maybe from where you sit, what should be the way forward for this program? And perhaps what challenges have you faced over the last 9 years? What are the challenges seen?
This program, I think it's a good program. As I mentioned, it's a collaboration between the Ministry of Health and Ministry of Education, and it's a holistic program. So we are looking at doing the deworming exercise, in addition to improving water sanitation and hygiene, improving nutrition. So it is actually an interministerial, intergovernment collaboration, and we are seeing this collaboration actually extending and becoming, you know, now the school health program generally covers all schools in Kenya, but the deworming program is now targeting now those specific counties. So holistically, you can see that the school health program advocates for, you know, disease prevention and control. It communicates for, it advocates for water sanitation and hygiene. So in all the other schools, preventive measures for worms are being instituted. So we can only see the health of the learners improving over time and getting better.
But you mentioned that this is not just a very, the issue or the deworming program is just part of a bigger program that government is undertaking in schools with regards to health?
Yes. Yes, it is.
So maybe then the other issue has always been what we normally see that the players in issues about health and education in this country sometimes is always a bit over-reliant on donors, people like the WHO, people like the World Bank, who are the partners other than maybe government in this program, or is it a fully government-funded program?
So the government of Kenya provides the drugs that we are using to deworm. But we also are working together with Evidence Action and the Give Well Fund, who are supporting, you know, like the trainings. My colleague Jeremiah mentioned that it's a cascade approach, where we bring the county management together and we discuss the issues of deworming, and we train them about how the deworming exercise is going to be carried out. Thereafter, this county, we call them trainer of trainers, will now go now to the sub-county, train them. Now, after they train at the sub-county level, they will now go and train the teachers on how to carry out the deworming exercise, how to look out for any side effects, and how to report. And so now these reports now cascade now upwards on how many learners were reached in each and every school. And over time, we've been seeing there's been an increase in number of learners who have been covered over time. So we are expecting actually to be able to treat even more than the 6 million at-risk children. Yes.
Maybe if going back to Nerea, then you are in charge of primary schools, but the parents are in charge of the children. There are those who sometimes, as I mentioned to Dr. Ombugu, are a bit reluctant about doing this, especially with the children that perhaps don't even go to school. What's your message to parents today?
Yeah, thank you so much. Indeed, before the deworming exercise is done, or any other intervention is carried out in the schools, we are in a democratic space where we must involve the parents. And that is why the training is cascaded down even at the school level. So the school head teacher, who plays a very, very big role, together with the health teacher, will involve the parents by sensitizing them and asking for their permission. We do not just get to the learners, that we are in charge of schools and start deworming, but the parents must also give their consent. And a lot of times you find that they are really yearning for it. We've been in places where you find that the parents have come in, brought even the young ones, even below 2 years, and we tell them, no, this one is too young to be dewormed. So the involvement of the parents is very, very key. And I would also want to say that from what my colleague in Kisumu said, that we have seen a lot of impact, a lot of improvement, especially in the girl child performance. Indeed, that is very true. if you look at what has gone on for the last 6 to 7 years, the girls have been taking a very, very key role, especially when the results are announced. And this one comes about because of several interventions that the government has put in place. Other than deworming them, the government also provides for sanitary pads to all girls in all our public schools, starting from class 6 to class 8. So that the girl has a lot of time to concentrate in her studies. After being dewormed, you also have your sanitary pads, and therefore yours is now just to concentrate and ensure that you get the best of what you should give to yourself, to your family, to your community, and to your nation. Thank you.
Okay, and maybe to you, Jeremiah, as we of course try to wrap up this conversation, there are those who argue that sometimes instead of maybe treating it, isn't there anything like a vaccine that the children maybe can be given to as a sort of proactive approach, not really reactive?
Thank you very much, Kiprop. I think the vaccine, so far we may not talk about vaccine for worm, specific vaccines, but we have vaccination for other diseases, which today we're just talking about the deworming using drugs, and the drug that we are talking about today, we are going to deworm for common worms. That is, we are talking about whipworm, we are talking about roundworm, and we are talking about hookworm and schistosomes. These are intestinal worms. These are parasites. And these parasites are in us. They are in our intestines or in our urinary bladder, like the bilharzia. So we are not talking about vaccine. We are talking about albendazole, which is 400 milligram, 1 tablet, which is 1 dose for children aged 2 years up to 14. Yes. And this drug is safe, very effective, and highly recommended by World Health Organization, so that we deworm our children every year, once a year. But areas which are heavily infected or infested with worms, we can do it twice. Yes. Okay. According to what Dr. Christine said. Yes.
Thank you, Jeremiah. We're running out of time, and we need to close this conversation. Let me just get your closing remarks, and I'll start with you, Madam Nerea.
Yeah, thank you so much. Really, it's a very good moment sharing and even give a talk to the nation of what we are doing as a government to ensure that we have a healthy nation. I want to ask parents, I want to ask everybody who has a child 2 years and 2 years to 12 years to ensure that in the availed 14 counties that my colleague has mentioned, let us avail our children, the learners, to be dewormed. It is really very, very healthy, and it is a government project which is free of charge. Nobody will charge you for anything, but we all have the benefit of what we get once a child is dewormed. Thank you so much, and karibuni nyote, tunawangojea ili tumpokee hiyo dawa ya minyoo. Asanteni sana.
Okay, Jeremiah, you are definitely in Kisumu County where the program is ongoing from today. Maybe just give us your parting shot.
We welcome you all to participate in the school-based deworming program. The site that will be visited today by CAS Education will be Manyata Primary School, Kudo Primary School, and others. We are going to deworm in all public primary schools in the county, including the 14 counties that I mentioned. Starting from today. Today is 15th, Kisumu is their deworming day, and we are calling upon parents to allow children, all children to 2 to 14 years, to be dewormed against these soil-transmitted illnesses, to be able to improve education and health of their children. And the drugs that we are using, albendazole tablets, are safe, free. The government is paying for the drugs, free, effective, and recommended by World Health Organization and Minister of Health and we are calling upon everybody to participate, including ECD children will be dewormed, and we are deworming both enrolled, the children in our school register, and non-enrolled. The children will be brought from home, especially the ones who are not in school, probably 2 to 3 years, who are still not in school. Maybe they are not in ECD, and this is a program that is being supported by Evidence Action, Deworm the World, in collaboration with Ministry of Education and Ministry of Health, together with our counties, and we are in 27 counties, and for this year, we are deworming in 21 counties, And this year we are only deworming for soil-transmitted helminthes and not schistosomes, because the availability of praxiquantel was a challenge. But this is we are still doing routine. So in case you miss deworming in our schools, which will be done by trained teachers, I'm one of the master trainers for this. So you better get to our facilities where we are also doing routine services. So my last slogan is that we can join together in National School-Based Deworming Program. We have this slogan, keep up. Kwa afya na elimu bora tuangamize minyoo. Can we say it together? Kwa afya na elimu bora tuangamize minyoo.
Thank you very much, Jeremiah. Kwa afya na elimu bora tuangamize minyoo.
Kwa afya, get it very clear, that's our slogan. Kwa afya na elimu bora tuangamize minyoo.
Okay. Asante sana. That is Jeremiah. Very wonderful slogan. Yes. But I'll allow you, Dr. Wambugu, to close the conversation for us.
Okay, thank you so much, Kiprop. As my colleagues have mentioned, the exercise is ongoing today. We also have our senior Ministry of Health officials who will be providing oversight for the deworming exercise. We have our head of the Department of Family Health, Dr. Isaac Bashir, who will be with the team in Mombasa. We have our head of the head of the Public Health and Medical Services, Dr. Andrew Mulwa, who will also be with the team in Mombasa. They will be at Star of the Sea School. And our own Director General, Dr. Patrick Amoth, will be in Homa Bay tomorrow, and will be together there providing oversight over the exercise. So we encourage all the parents to allow their children, the learners, to access this intervention because we can see the proven benefits of it. So kwa afya na elimu bora tuangamize minyoo.
Tuangamize minyoo. Kwa afya na elimu bora tuangamize minyoo. What a wonderful slogan that Jeremiah has coined it for us to close this conversation, and that's where we leave it this morning. We have been talking about the National School-Based Deworming Program, which is actually being undertaken by the national government through the Ministry of Education and the Ministry of Health, along with other partners who have already been mentioned by Jeremiah. And of course, this conversation, many thanks to you, our viewers, for keeping us company, as well as my guest this morning, Dr. Christine Wambugu. She's the head of the Division of Adolescent and School Health at the Ministry of Health, of course, as well as Madam Nerea Olik. She's the Director of Primary Education at the Ministry of Education, as well as Jeremiah Ongwara. He's the County Public Health Officer in Kisumu, in the county of Kisumu. That's where we leave it. From me and the entire team, it's goodbye. But remember, tomorrow again from 7 a.m. to 9 a.m. we will be back with you with yet another exciting conversation, and we will be talking about the business of fashion, especially for men. Be sure to tune in from 7 a.m. to 9 a.m. See you then. Goodbye.